Our Southwest Kentucky market, which includes Blanchfield Army Community Hospital, all Fort Campbell Medical Clinics, Screaming Eagle Medical Home in Clarksville, Tennessee, and Woodson Health Clinic at Rock Island, Illinois, goes live with DHA Electronic Health Record, MHS GENESIS, June 3rd, 2023. Major Mark Workman, Blanchfield's Clinical Service Chief, is here to talk about what you as a Fort Campbell TRICARE beneficiary can expect prior to, during, and after the transition of Genesis in reference to patient appointments and the patient portal. As we transition to MHS GENESIS, your providers and clinical staff will need time to learn new workflows and procedures before our go live date, which we've been doing. They will also need time to put those new workflows and procedures into practice after our go live date on 3 June of 2023. We will continue to provide you with safe, quality care during this transition, but we want you to know you may experience some changes and potentially some longer wait times. Mark, welcome to the set today. Really appreciate you joining us to talk a little bit about MHS GENESIS.
Thank you, sir.
I know that you and the team are really working hard to work with our beneficiaries to put together, make sure that we're still able to support our beneficiaries, all 70,000 beneficiaries and our soldiers and their families. So could you tell us what type of changes can our patient population expect during this transition time frame that we're about to experience?
Yes, sir. So during this transition period, we are expecting probably the biggest thing that people are going to notice is things are going to take just a little bit longer than they normally would. Everything from scheduling appointments to getting checked in at the front desk, and even the amount of time that they spend with their provider. And that time is going to extend just a bit as the staff work to navigate this new system.
Yeah. Absolutely. I mean, this is a historic system change for us and the entire Department of Defense. We're actually the last, one of the last platforms that are changing over, and so that's good for us because there's a lot of lessons learned out there that we've already had to implement. But it is new for everybody. It is a new historic change for the organization, and it's going to take some extra time. We appreciate everybody's patience.
Sure.
How long do you anticipate those wait times to last over the period of time? I know that as we go live on 3 June, the likelihood those first couple of weeks are going to be a little rocky as we get folks in and we get folks coming in for care or folks that come into our other sites, clinical sites. Can you tell us a little bit about how long those wait times may extend and will we see that decrease over the next couple of weeks?
So the short answer is yes, we are expecting to see those wait times increase. The reason for that is we've had to decrease some of the appointment access that we've provided as we're learning these systems. And so during the month of June, there will be some pretty significant waits. We are anticipating, though, that by August, a lot of the main month of transition will be complete. Then the following month of July, we'll be working through a lot of the backlog of some of the care that's had to be delayed. And so by August, we're anticipating to be a little bit back to a normalcy.
Yeah, June will really be a transition month for us, which works out here at Blanchfield because the June is really a month where a lot of people are in and out of the facility. They're going on vacations. They're doing other things. There's a lot of transitions, and so truly, as this landed in June, not our choice, it really works out very well because we have the ability to to really minimize the volume of folks there. In July, we'll continue to ramp up. And we hope by August timeframe we'll be in a pretty good normalcy for the organization. We're also offering 5 school and sports dates on Saturdays prior to this so that we can really take advantage and alleviate the volume that's going into the clinics for those sports physicals. And those folks would not have to make an appointment for that. And you'll see those in our public affairs outreach and our Facebook page. We'll be talking about those physical dates for our parents. That way we don't get to a beginning of school time frame and have a huge volume of people trying to squeeze in when we have potentially limited appointments. The good thing about it is school locally here, we have the ability, we'll probably be back up to a more normal state by the time school starts in August. Absolutely. What's the priority of services our patients can expect to receive throughout this transition?
Yes, sir. Well, most services that we provide are going to be based off of our capability and availability to provide those. But the 3 that are going to be prioritized are emergency services. They're also going to be the medically necessary surgeries and then followed up by the time-sensitive outpatient appointments.
Absolutely, great. What happens to TRICARE's online patient portal as we are in this transition framework? I know I've been in the portal over the past couple months a few times, and there will be some changes to it in the future. Can you talk a little bit about that for us?
So the TRICARE online patient portal is ultimately going to be going away and is going to be replaced by the Genesis patient portal. The ability to secure message through the TRICARE online patient portal is going to end May 26th, I believe it is. And then that's also going to be like about the time when they're going to be able to restrict online appointing as well.
Okay. And we know that as the Genesis portal comes online, folks they'll experience the same opportunities to make appointments, to take a look at records and other things, and that actually is going to be enhanced with Genesis. Is that accurate?
It is, yes, sir. So there are a number of things that the MHS Genesis is actually going to provide in the patient portal. So we're going to have everything from being able to request appointments through the care teams, able to review some of the notes, labs, and ancillary service results through there. They'll also be able to, like mentioned earlier, exchange secure messaging directly with their providers and care teams. But one of the things that I think is really kind of cool that I don't believe that the TRICARE Online has offered is being able to actually renew prescriptions.
Absolutely.
So this one's going to be huge, whereas before patients have had to either call in or have had to actually make another appointment to come in to review medicine for the provider to say, hey, you're on track,
Sure.
We're going to put in a new one. This one, they're going to be able to actually submit a prescription renewal request online. The care team will then be able to review it, and if approved, then that completely cuts out the appointment process altogether.
Yeah, and I think that's a great opportunity in the future to really decongest the system, because as a nurse, I know that there are a lot of times when I was in ambulatory clinics working as a nurse, you would see patients come in and they would get to the door and you'd realize this appointment really wasn't necessary. It was for something that could easily be handled in that capacity. So that is definitely going to be good for us. So again, our pharmacy team's done a really phenomenal job over the past year and a half here at Fort Campbell of really driving down the volume and the wait times, and so that's really helpful. And I think that will only get better. Again, we'll get through this transition as a team. Our team at Blanchfield is very prepared to make the transition. It is a transition, it is a historic transition, and candidly, we've got to make sure that we will look at where we have gaps and challenges, and we will address those gaps and challenges to make sure we're still providing great care to our patients.
Sure.
If patients want to view their medical records electronically, what should they do now to prepare for the MHS Genesis transition on 3 June?
So there are two main things that they need to do and review. The first one is going into DEERS, the Defense Enrollment Eligibility Reporting System, I believe is what is, or DEERS.
Got it right. Good job, Mark.
Through MilConnect. But go in there, make sure that their information there is correct. Their email, their phone number, make sure that they've got all their dependents listed like underneath them. Also make sure that they're assigned to the right facility. So that's the first one. And like everything that's in there that's about their information, just need to make sure that that's updated and correct so that it feeds correctly into the MHS Genesis. The second thing that they need to do is, especially if they are not utilizing a CAC-enabled computer, to create a DS logon account if they don't have one already, so that that's the system that you'll be able to access Genesis through.
Yeah, and I know from our family's perspective, we went to create a DS login account and realized we already have one and we're using it. So that was, I think, what a lot of our beneficiaries that are actively using these systems will find out is they already have a login. But making sure they get in and they are able to get into that and have it ready to go for when we do transition to Genesis is going to be really critical. And I can tell you, getting on TRICARE Online recently, I was able to download my entire record pretty easily, and I think that helps for folks to go in there and do that prior to the transition.
Actually, and you do make a good point about that, sir, because when we move away, because TRICARE Online is a different entity altogether from MHS Genesis, the secure messaging that's done through TRICARE Online, things like that will not transfer over.
Sure.
So if there's anything there that that our beneficiaries want to keep, they need to go in and try to download those ahead of time so that they can actually
Those
have those.
TRICARE secure messages with their provider, the historic messages.
Yes, sir.
Absolutely. And so I think the other part of it too is if there's messaging that has occurred very close to this transition timeline, I think it's really important that they follow up with their care team, whether it be with the clinic or on the new system, just because there may have been some gaps when that transition happens for
Yes,
sure.
sir.
Outstanding. Can you explain to us what patients can do with this new MHS Genesis patient portal? How is that going to help them really manage their care and help them connect to care and get the care they need and get it seamlessly and efficiently and hopefully without even having to potentially make a visit?
Right. So a number of these capabilities were things that we've mentioned just briefly ago, but the intent behind this, the broadening capabilities that this will bring, will really help drive the patient to help manage their own care, to drive that a little bit further. So we'll be able to work on scheduling appointments for both medical and dental. There are some questionnaires that they'll be able to complete online particularly on the dental side. They'll be able to review those results for labs. They'll be able to submit renewal prescriptions. There's just just look at their history and message securely with their care team. So this really opens up quite a few options that might sound similar to what they've had through TRICARE Online, but this kind of it provides that and then some.
Absolutely. Once we make this transition, can you talk a little bit about how patients can access their record after the transition?
So after the transition, there are a couple different ways. So if you want to access it through the TRICARE Online, you do have that capability. However, on June 3rd, that becomes not inactive, but read-only. So they'll be able to go in, they'll be able to look at items, but I believe it's in August. TRICARE Online will be decommissioned and will go away.
So the ability to go in and actually look at your record will last a little longer than the transition. But in August, you can expect in the near future after the transition that capability will go away.
Correct.
Good. So
like the health records, the health stuff that's in TRICARE Online, like those things will transition over into MHS Genesis. The secure messaging though will not.
Okay, and so I find myself very often, we have so many sites and so many passwords, I find myself resetting passwords every day. If folks are having trouble accessing this portal, what are some of the things they can do? Is there a contact number, or is there something they can do to connect?
There is. So the main way that if they're having issues, that's not anything that we at Blanchfield are able to actually.
Right. Yeah, this is an
assist with.
enterprise level system, so it's
is.
not something we control.
So what they will need to do is they'll need to contact the Global Support Center. They've got a phone number for this. It is 800-600-9332. So for all MHS Genesis, patient portal issues, contact that phone number with the Global Service Center, and they'll be able to help take care of them.
All right, great. So Mark, let's move on to patient appointments. Why is it really important for patients to schedule their appointments well in advance?
Well, as mentioned, as I alluded to earlier, as our staff are learning the ins and outs of the system and getting more familiar with it, there's going to be a little bit of a lag time on how familiar they are with it, and as we move on, they become more fluent and are able to utilize the system more quickly.
Right.
Initially, though, they need that time to learn the systems, and so we had to restrict appointments to help the providers do that correctly. In a lot of ways, it becomes a patient safety issue,
Sure.
so that everything is documented correctly.
Yeah.
What that does, though, is that causes fewer appointments in the day, which causes fewer appointments in the month, and as we're going on, it just kind of pushes that further down. So those people who need a continuity of care, who need routine well checks or wellness exams, or have some other sort of time-sensitive appointment or need,
Sure.
they need to start scheduling those appointments now, as opposed to when they think that they'll need them here in the next few weeks, because at that point, appointments are going to get scarce. And so by booking them now, we can make sure that they're taken care of when that time
Sure.
comes.
Yeah, I know we have a tight window coming up here till we transition, but I also tell folks that this is definitely not the time to decide that you haven't had a physical in a number of years and let me try and book it the first week of June. It's just, it's definitely not a time for that care that potentially could wait. We never want folks to wait on anything acute or even routine clinical issues, but those exams that potentially are a little earlier than they would normally be could potentially wait a little further. You talked about TOL as really having a limited timeline. Again, you said that patients can use that through August. We encourage folks to get in there now to take a look at their record and then potentially get some opportunities to download their record or download labs and x-rays and all those things like that so that they have that. We talked about the DS login that folks have. Is it a requirement for care that our beneficiaries have a DS login account?
It is not.
Yeah.
So anybody's able to schedule appointments. They call in through the call center and can make appointments that way. MHS GENESIS patient portal is not required for any of that.
It's a nice convenience for folks, especially
absolutely.
as folks after hours or on the weekends when you decide, hey, I need to. You're collecting your business. You're working through all of your lists that all of us work through on the weekend to catch up from the week, and so it is convenient for that. But it is definitely not a requirement. Not a requirement for care. And so as we take a look and we're engaging our patients when they come into the clinics right now, we are encouraging them to do it because it will benefit them, but at the same time, it is not, we want to make sure beneficiaries know that, okay, I didn't do a DS login account, I got too busy. It doesn't mean you're restricted from care.
No.
That's the big thing. Is there an app for the MHS GENESIS portal?
At this time, there is not.
Okay.
However, any web-enabled device, you're able to access MHS GENESIS through that.
Sure.
So it may be something that they develop in the future, but at this time, not quite.
Absolutely. So as we talk about, we know that there's going to be volume, the normal volume of care that we have every day, and we do almost 3,700 appointments every day across Blanchfield. Are there some alternative healthcare options for our patients for them to receive support in the event they can't get an appointment or they need it? I know that our emergency room is really reserved for emergencies, and we want to encourage folks to use it for emergencies too. But are there other options for folks for alternate care during this time where we're going to be in a decreased appointment status?
There are. So there are three sort of main ways that we let people know about. One, if they have an emergency, call 911.
For emergencies, absolutely.
Absolutely. Yep. Another option is using the nurse advice line, 1-800-TRICARE. So that'll get you to a nurse over the phone, and they'll be able to help you book an appointment or give you authorization to go off post.
Right.
And then the last one is there are a bunch of TRICARE network urgent care centers that are available to them, and I believe we've identified some of those and help.
Right. We have, and those are being put out across the board, and we know that it's different for active duty that would require a referral to urgent care versus our family members and other beneficiaries that would not require a referral to urgent care. Those are the type of things that I think is important to state because we will have a volume challenge for those first couple of weeks and maybe in the first month. And so there are all alternative care options in the area that folks can get into. Beyond that, I just want to make sure that our patients understand that they just continue to look at our websites, continue to look at our Facebook page, continue to look at, connect with our clinics. As you go to your appointments in the next couple of weeks, you'll see materials that are out there in the facility. Stay informed, stay ready for changes, and we will continue to put information out. It's really just important as we make this historic transformation to a new health record. We haven't had a new health record for many, many, many years. The Department of Defense has gone through this at a lot of locations, and it's gone very well. There's always some snags, but I'm very confident the Blanchfield team they're just a phenomenal group of professionals, and we will work with our patients to get through this change, and it will make us better in the end. It is, a bit of an uphill climb as we start, but our team has been training, they've been preparing, we've got new equipment that's come in, and we will continue to every day work on improving the volume and improving the care so we can get back and do what Blanchfield Army Community Hospital does, provide great, safe, high-quality care to our beneficiaries and our soldiers and ensure that they're able to deploy and support any operations across the globe. So our patients are really, they're the center of everything we do, and we appreciate all the support, especially during this big transformation that we're making here at Blanchfield. And as you know, this is the last site that the MHS GENESIS will roll out besides Europe. So our beneficiaries, as they move around, and PCS, especially some this summer, they're very, very likely going to be headed to a site that's already MHS GENESIS ready, and that will really, really help them for sure. So, Mark, I just want to thank you for your leadership, for your time, and for talking to us about MHS GENESIS today, and really appreciate all that you do, and thanks to all of our folks and all of our beneficiaries, our staff, and our patients. As always, you are at the center of everything we do. Thank you for your patience and understanding as we make this historic transformation and transition safely to our new electronic health record.